Okay, so this is protocol 4, supine, patients face up. For those that need a little bit more extension or Mackenzie-like movement, so you can change the radius of the lumbar going out. This will come up to fan the lower spine and support that lordosis as it positions the discs and stretches the core muscles, and you can change the position of the legs down. Touch of a button, that's what's unique about this. The intimate control you can have, the clinician, on spinal three-dimensional positioning and mobilization. So important for overcoming spinal herniation and bulging discs and degenerative disc disease and facet syndrome, to be able to relieve the pain from those things and to mobilize with the clinician and physical therapist and chiropractor, mobilizing it. You can change your angles very effortlessly, and you get your full extremity stretch with the ankle cuffs and the lumbar belt. With the best of both worlds, you're distracting the lumbar spine as well as a full extremity, should you need to do that. Of course, you can just use the ankle straps, or you can just use the lumbar belt. It can be set in an automatic protocol, which we're just doing right now. It's automatic to start mobilizing and putting motion into those segments. So this is now extending outward and coming back in. Now, if he has a lateral disc herniation and pain down his right leg, and when I tested him, he had relief bending to the left, I can move this to the left, the leg extremity. And what am I doing? I'm opening up the joints of the spine to create a space in the spine prior to stretching, so no nerves are entrapped as you're stretching. And the patient can participate. I'm going to ask the patient, I've enabled the switches under supervision, so he's going to press the green button with the right hand, and he's going to increase under supervision a little bit more pulling force that gives him a little bit more separation of the joints of the spine. It's going to go in automatic. When it comes out, he's having some input to that. Also, he can reach over his head and grab, and using this button, he can extend the leg piece here using these two buttons while he pulls up and does a therapeutic exercise. He's pulling up and stretching at the same time while the leg piece and his body is three-dimensionally positioned. And during treatment, the clinician can alter his position for different clinical effect. He can reduce the stress on the back if it's too much extension, and treat him neutrally, which might be enough benefit for the initial few treatments. So the patient has input. By pulling up, he's contracting the muscles. He's causing intrathecal pressure to push that disc back into position if it's extruded outward. And we're going to move this to the center during treatment, towards the end of treatment, and let him stretch a little bit with the machine and pull up when it goes outward. It's on the cycle going in, he's relaxing. When it goes out, he's going to pull up with the arm bar, and he maximizes the decompression effect, the distractive effect, causing a greater vacuum and better separation of the joints for pain relief. After all, it is those joints that are richly innervated with pain receptors that are being overstimulated by compression, and you want to decompress those areas and remove pressure on the structures that are causing you pain. And this is the most efficient manner to do it, and do it intelligently as needed based upon the patient's condition. His spine is three-dimensional. Treatment needs to be three-dimensional, not unilaterally dimensional, not just axial. This is why Extentrac is responsible for greater outcomes based upon unique, customized, special treatment with the multiple positioning, the three-dimensional positioning, very important. And I'm going to cancel cycle, patient